Good day, everybody. I am Dr. Natesh, consultant orthopedic surgeon and professor of orthopedics. I am working at Virinji Hospital and professor at Iron Medical College. I am going to speak on fourth wave of COVID. So the first question is, what is this XE variant and how severe is it going to be? Yes, definitely any virus will come in clusters of cases which are called waves, and that has been the case with Spanish flu in 1919, and that is the case with COVID as far as we have seen. And with each passing wave, the intensity of the virus reduces, as well as the virus also weakens, as we have seen, as it has been seen with our experience. And even the contribution of vaccines is tremendous. So XE variant is a mutation that has happened in the virus, and as far as the data available right now from the cases in New Delhi as well as in Mumbai, we find that the XE variant is not as severe as Delta variant, which we have seen in second wave, and our vaccines are performing a decent job in providing immunity and reducing the mortality and severity of the cases, though there may not be much effect of vaccine and previous infections on reinfection rate. The severity of infection appears to be low, taking into consideration the ICU admissions and the patients who are succumbing to the disease. So I don't think with these circumstances, though the infection rate is high, the severity and mortality rates are considerably low, even in Delhi and Mumbai. So I don't think lockdown is something that we can even imagine. First thing, and the number of cases, of course, they are increasing. The days are going by, but still patients are recovering, and the symptoms are just more like a flu and other upper respiratory tract infections with body pains, fevers and all as of now. Patients with long-term diseases like patients who are on chemotherapy, patients with diabetes, hypertension, chronic heart ailments or renal issues, they have to definitely take care, because as the virus infects, the body will be subjected to stress, and for a normal individual with the same age group, the patient will be able to recover fast compared to patients with having all these comorbidities or one of these comorbidities. So patients with comorbidities will definitely have to take extra precautions, and the precautions are going to be the same, like getting a booster dose, hand sanitization, social distancing and mask. So patients with who are infected with previous waves, previous variants of the virus, and patients who are patients who already got vaccinated, definitely the severity of infection is going to be low, because similar proteins are already presented to the immune system, and immune system must be in a condition to effectively defend itself from the new variant. But there are certain reports saying that XE variant and fourth wave, whatever virus mutations have been caused, in these mutations are escaping the immune system, and still they are causing some considerable infections in patients. But even though the immune system is bypassed, the severity of infections is not as severe as in Delta variant. So get your booster shots. Regarding the foods which we have to take in COVID, similar to previous waves, definitely there have to be balanced diet, and high protein diet is always preferred with lot of hydration, especially during the summer months. Regarding the foods that we are going to take, especially because of the summer months, the diet is not going to be any different from previous waves, and it includes a lot of protein and hydration as well. And regarding to the wave and the conditions in China, I doubt whatever data we are getting from China is 100% accurate. So going by believing whatever we are getting in the media as to be true, the condition in China appears to be grave because of lockdowns and scarcity of medicines and groceries. But what I feel is maybe because of immunization programs that have been run there, or because of patients zero COVID policy, patients have not been infected, not developed sufficient immunity or from the previous waves. So there are many patients who are getting infected for the first time in this fourth wave in China. So that may be the reason for the severity of infection going by the news channels. As rightly said, right now there is wedding season and festivals are also around the corner. There will be a lot of gatherings and people are in mood of removing their masks and going back to their pre-COVID social interaction. So all these will definitely pose a threat to fourth wave, and we have to consider that mask, hand sanitization and avoiding social gatherings are definitely going to save us from the fourth wave. So please adhere to these restrictions, and even Telangana government and Delhi government, they have reinstated the rule of wearing masks and avoiding social gatherings.